Hello. Multiple sclerosis, or MS, can cause a wide range of symptoms. No two people will have the same experience, pattern of symptoms, frequency of flares, or progression of their disease. Its unpredictable nature can be one of the harder aspects of living with MS. Despite the differences, there are many symptoms that may affect lots of people with MS. Some of the most common symptoms people get early on in their diagnosis include eye problems, such as blurred vision, eye discomfort, or pain; fatigue; unusual feelings in your skin, such as numbness or pins and needles; stumbling when walking, or slower thinking and difficulty finding the right words. These symptoms are quite varied, and many can be attributed to other health conditions. This makes the diagnosis of MS difficult and sometimes delayed. The ongoing symptoms in MS can be grouped. Balance and coordination problems. This includes dizziness, tremor, and being very off balance. Bladder and bowel issues. You might find it harder to control your bladder and bowel, or experience issues like constipation or urinary tract infections. Pain. You might experience nerve pain or muscle spasms. Speech and swallowing difficulties. Nerve damage can affect the muscles of your mouth and throat, making you stumble over your words or experience difficulty swallowing. Sexual dysfunction. Nerve damage around the genitals can affect sensation and erectile tissue. Being stressed, ill, or extremes of heat can trigger a relapse of your symptoms. It can take time to come to terms with a new diagnosis of MS, but there's lots of support available both online and in person. You'll be assigned a specialist MS nurse who you can contact with any questions or concerns. There are local support groups led by experienced volunteers, as well as excellent websites and online forums. Currently, there's no cure for MS. Once diagnosed, it's something you have for life. However, there is ongoing research into treatments for MS. There are a number of ways to manage your condition, including medications, exercise, healthy living, and diet. There are some wonderful books that explore complementary medicine in MS, including Overcoming MS by George Delanek and Forks Over Knives Living Diet Program by Dr. Campbell. In the short term, life doesn't stop at diagnosis. It's too early to predict what life with MS will be like. Longer term, your symptoms will vary from day to day and from year to year. For some, the course of MS will affect their life and the choices they make along the way, but MS does not need to define who you are. Continue to live by your core values and always ask for help when you need it.